Well, welcome everyone. Thank you so much for taking time to join us today for this important conversation about epilepsy and premature mortality. My name is Gardiner Lapham, and I come to this work not only as an advocate, but as a parent who lost a 4-year-old child to SUDEP, or sudden unexpected death in epilepsy. Like too many families, I didn't learn about the risks associated with epilepsy until it was too late. My child was young, healthy, and thriving. I could never have imagined that he would die unexpectedly in his sleep after a seizure. Since Henry's death, I've dedicated myself to raising awareness, driving research, and pushing for policies that can save lives. I helped co-found PAME, or Partners Against Mortality and Epilepsy, an initiative that promotes efforts to prevent SUDEP and other causes of preventable mortality. And our family foundation, the Band Foundation, supports efforts that advance SUDEP research and prevention. As some of you might already know, epilepsy affects more than 3.4 million Americans, yet it's still one of the most underfunded and misunderstood neurological conditions. People with epilepsy are up to 3 times more likely to die prematurely than the general population. SUDEP is the most common cause of epilepsy mortality. Every year, 1 in 1,000 people will die from SUDEP, sorry. This means thousands of families lose loved ones every year. We're here today because these deaths are not inevitable. By expanding research, improving education for patients, providers, and the public, and supporting practical measures for prevention, we can save lives. That's why we're calling for a national plan for epilepsy to bring focus, coordination, and resources to address gaps in research, care, and public health strategies. A national plan would mean more answers about SUDEP and epilepsy mortality, better education for families and health providers, and stronger support for proven prevention strategies. Today, we have an exceptional panel to help us understand the human impact behind these statistics and what is needed to better understand the problem and make progress towards prevention. First, you'll hear from Libby Boyce, mother of actor Cameron Boyce, whose life was tragically cut short by SUDEP at just 20 years old. Libby has turned her grief into powerful action, creating an organization to honor Cameron's legacy and raise awareness so other families don't have to face what hers did. After Libby speaks, we'll hear from Dr. Dan Atherton, a medical examiner from Alabama and a leading voice on SUDEP. He'll help us understand what SUDEP is, what causes it, who's at risk, and how we can prevent it. He'll also describe current barriers to progress. And then finally, we'll hear from Tom Stanton, Executive Director of the Danny Did Foundation. Tom's organization supports families, educates communities, and advocates for seizure detection devices that can help save lives today. His foundation was created in memory of Tom's nephew, Danny, who also tragically died from SUDEP. Our hope is that you leave this discussion with a clear understanding of why epilepsy mortality deserves urgent attention and how a national plan for epilepsy can drive progress towards a future where no family loses a loved one to preventable epilepsy death. Thank you again for being here and for your commitment to learning and taking action. And before we begin, I'm honored to share welcoming remarks from Senator Eric Schmitt, whose oldest son, Stephen, was born with a rare genetic condition called tuberous sclerosis. He also has epilepsy, is on the autism spectrum, and is nonverbal. Stephen was Senator Schmitt's inspiration to run for public office so he could be a voice for individuals like Stephen and their families. That experience inspired him to champion legislation supporting families of children with special needs, including the National Plan for Epilepsy Act. We're so pleased to hear from him today. So I will turn it over to Senator Schmitt. Oh, and that's a picture of my son Henry, who passed from SUDEP. And now these are the panelists that you will all meet. And then I think we've got Senator Schmitt right there. Thank you.
Good afternoon, everyone. Senator Eric Schmitt of Missouri here. I want to thank all of you for coming, and thank you to the Partners Against Mortality and Epilepsy for hosting this briefing today. As most of you know, this cause is personal to me, as my son Stephen lives with epilepsy. Stephen's 20, soon to be 21. As the 4th most common neurological condition in the United States, it's important that we work together to provide support and resources to epilepsy patients and their families. As the co-founder of the bipartisan Senate Epilepsy Caucus, I introduced the National Plan for Epilepsy Act. This is a bipartisan bill to encourage the development of safe and effective treatments and strategies to prevent, diagnose, treat, and even cure epilepsy. That's the hope. Our goal is to improve quality of life for individuals with epilepsy and their caregivers. And while this bill is only a first step, I'm proud of the work the Epilepsy Caucus is doing to bring home more awareness to this condition and explore new treatment options for Americans with epilepsy. So thank you again for your interest and your support. God bless you and take care.
Oh, thank you so much, Senator Schmitt, for those pre-recorded remarks. Your leadership on this issue is remarkable and deeply appreciated. So now let's hear from our panel, and I'm really happy that Libby Boyce is able to join us here. And so Libby, as I mentioned, you're the mother of actor Cameron Boyce, and I'm passing it over to you. Thanks for being here.
Thank you, Gardiner, and thank you everybody for being here. All our congressional leaders really appreciate this opportunity and this platform. As you all have heard, I'm Libby Boyce. I'm the mother of Cameron Boyce. He was a young man who died of sudden unexpected death in epilepsy, or SUDEP, when he was 20 years old. Cameron was an incredible and giving human. He had a light inside him that was so bright. It was just a joy to be in a room with him, never mind be his mother. Additionally, Cameron was a fairly well-known actor, as has been mentioned, who had about 15 million followers on his Instagram. And I mention this because it led me and his dad to establish the Cameron Boyce Foundation to ensure that we continue to use his voice and our voices to increase epilepsy awareness and to reduce the shroud of mystery that surrounds epilepsy and epilepsy treatment, to emphasize the ins and outs of living with epilepsy, and especially for young people, and to hopefully reduce the stigma that surrounds epilepsy. Cameron had his first seizure when he was 16 years old. He had no pre-existing condition. So it was big, it was scary, and it was a big surprise for us. At the ER, we were told that he could have one free seizure in his lifetime, and that it wasn't until the second seizure that he would actually be given the diagnosis of epilepsy. Well, he had his second seizure a year later when he was 17. He died at 20 in his sleep during his fifth seizure, in the prime of his life, with so much ahead of him. Every parent blames themselves, and me and Victor and my husband, Victor, are no stranger to the guilt and the anguish over the what ifs. While I don't know that Vic and I could have saved Cameron, we are very aware that we were not provided with the power of knowledge by our health provider. We saw a regular neurologist. No one told us that there were epilepsy specialists called epileptologists. And nobody in their right mind would want their children to see anything but a specialist. This particular neurologist gave us some medicine and sent us on our way. They did not share the importance of taking the meds, what to expect, side effects, should it be taken at the same time every day, the risks if you stop taking the medicine. With all of this as a background, we didn't know that you could die from epilepsy. We were both aware that should he have a seizure while he's out and about in the pool while driving, he could die by hitting his head, drowning, or driving off the road. However, we thought he was so safe because his seizures were always in his sleep. Little did we know that nocturnal seizures, him being male and his young age, were all risk factors of SUDEP. We never heard of SUDEP until the medical examiner told us and explained what SUDEP means. I'm not sure if I was not an LA County employee with some clout in my field that Cameron would have had the county's lead medical examiner do his autopsy and report directly to me and Vic about the cause of his death. Since starting the foundation, we've met so many families whose children have died from SUDEP. However, when I've asked them what the death certificate says, very few say SUDEP or even epilepsy. They say pulmonary or heart failure, drowning, or not known. This is a big problem because these deaths are very underreported. And consequently, they do not get the attention they deserve. And consequently, they don't inform the medical community about how important it is to talk about the fact that this can be a fatal disease. While the Cameron Boyce Foundation is focused on epilepsy awareness, this awareness cannot be separated from the depth of stigma that has in many cases made epilepsy an immobilizing condition. The stigma related to epilepsy has been present since the dawn of mankind, and it continues deeply even today. Sometimes the fear and concern of how others will view you or treat you become more overwhelming than the condition itself. And I believe this is the case with epilepsy, especially for young people who are already self-conscious about everything, even without a health-related issue. Epilepsy comes with such an out-of-control feeling. It's not linear, structured, or organized. You can't schedule around it or explain it well to others. So it consistently feels lonely. One of the dear people I've met on our journey has shared that the only time he's not worried about having a seizure is when he's having a seizure. Let that sink in. I remember Cameron having these feelings, even though he only ever had 5 seizures. He felt very isolated after having a seizure, and he felt as though his body was betraying him. Why? Why is the stigma of epilepsy so intense? I started my career as a medical social worker, and I worked with people living with HIV and AIDS. The stigma of HIV/AIDS was particularly awful. I mean, we had to don literal spacesuits to even approach someone with AIDS, and now that stigma is almost non-existent. This makes me really ponder why the stigma of epilepsy persists. Why do people living with epilepsy keep it to themselves? Why do they not seek care and support? Why are they more likely to be unemployed? Why is there lack of representation and safe places for sharing their experiences? The stigma hurts our cause. It hurts efforts to get more funding and research, and ultimately, it hurts the people experiencing epilepsy. My challenge to those in the medical community who are the lifeline for epileptic patients is to use their powerful positions to peel back some of these misconceptions and myths about epilepsy and to be the best stewards of information, especially for younger people who are much less able to process living with the realities of a chronic illness. The medical community is at the doorway of critical junctures and significant life events for newly diagnosed who deserve to be fully armed with information, the good, the bad, the potential pitfalls, how to notice their triggers, what things will likely cause more seizures, what they can expect when they start their medicines, taking it on their schedule, what to do if they have breakthrough seizures, what breakthrough seizures are, and yes, that it can be fatal if it's not taken seriously and or well treated. I've heard from many doctors and medical professionals that of course they cover these things, but somehow it's either not being transmitted in a way that can be understood or absorbed, or it's not being heard, and that's the challenge. Because of our having lost Cameron, people reach out to us a lot. I've talked to dozens of people who have lost their children and loved ones to SUDEP, and hundreds more who are living with epilepsy. And the resounding chorus is the lack of information regarding many of the very common aspects of epilepsy. Now, to the task at hand. It is critical that the Secretary of Health and Human Services establish and maintain a national plan for epilepsy to support the development of a comprehensive strategy to prevent, diagnose, treat, and cure epilepsy, and to improve the well-being of people with epilepsy and their families. There are too many families impacted by epilepsy to not address this disease head on. If not for Cameron and all the others who have lost their lives to epilepsy, then for all the people who have yet to be diagnosed in the future. 1 in 26 in their lifetime. The odds are high. Thank you very much.
Wow, Libby, thank you so much for your remarks and for sharing Cameron's story and photos with us. You said that stigma hurts our cause, and I think you are so right. And that's why it's even more powerful that you are stepping forward to talk about this issue because I think SUDEP is often in the shadows, and people often refer to it as a SUDEP secret. So you are breaking down these walls of understanding by sharing Cameron's story. Thank you so much, and thank you for all that you're doing through the foundation that you and Victor have created. I am now going to invite Dr. Dan Atherton to join us and give us more sort of specific knowledge on epilepsy and sort of how SUDEP works. Dan?
Thank you so much, Gardiner. I'm actually getting an error when I try to put my camera on, my camera is being used by another app, and I can't quite figure that out at the moment. So I'm just going to go ahead and speak through this, if that's okay.
That's great.
Okay, so thank you, Libby, for sharing that story. And my name is Dan Atherton. I'm a medical examiner from Birmingham, Alabama. I work for the Hearsing School of Medicine, and I've been working in the epilepsy community for about 10 years now. And I'm going to share with you a little bit about the science behind epilepsy and how that relates to epilepsy mortality, and specifically sudden unexpected death in epilepsy, or SUDEP. So what exactly is epilepsy? Well, epilepsy is quite simply thought of as a brain disorder. So what does our brain do? Well, our brain is sort of a marriage of biology and electricity. And so what that means is we have cells in our brains called neurons, and they use electrical charges to communicate. And it's kind of like your house. If something goes wrong with the electricity, well, things aren't going to turn on and off appropriately. And so in the case of epilepsy, that can cause people to have seizures. And so if someone has recurring seizures, more than one, as Libby explained, that's a diagnosis of epilepsy. And so, as has been mentioned before, epilepsy is very common. And so it says 1 in 26 Americans will be diagnosed with epilepsy in their lifetime. And so think about that. So if you work in an office with 25, 26 people, well, there's a good chance that someone will be diagnosed with epilepsy in their lifetime. That's a staggering statistic. Nearly 3.5 million Americans, 500,000 children currently living with epilepsy. Fourth most common neurological disorder. And so think about that for a minute. So we all know people with migraines. I have migraines. We know a lot of people with migraines. Well, they're uncomfortable and they can be very debilitating, but migraines don't typically cause death. A stroke can cause death, but that's typically going to be in older individuals. And then dementia can theoretically cause death, but dementia is almost always in older individuals. Well, how is epilepsy unique among all these things? Well, epilepsy can cause death, and unfortunately, it impacts both older and especially younger individuals. People with epilepsy have a 3 times higher risk of early death, and they're often young and in the prime of their life, as we saw in Libby's story. Go to the next slide, please, Allison. And so let's talk for a minute about epilepsy mortality. So people with epilepsy can die from epilepsy, as we've talked about. They can also die from other things. So people with epilepsy can drown. There's a certain form of a neurological disorder, seizure disorder, called status epilepticus, which is different than SUDEP. People with epilepsy can die of various natural causes. They can die from accidents. They might die of a natural cause and also have epilepsy, but maybe the death is more appropriately categorized as cancer or something like that, and not necessarily epilepsy. But what we're concerned about with, at least in my work and in this presentation, is mortality associated with epilepsy, and most specifically SUDEP, or sudden unexpected death in epilepsy. So SUDEP is actually the most common cause of death in people with uncontrolled seizures. And here's another statistic for you. It says SUDEP takes more lives annually than SIDS. So SIDS, you're looking at about 2,500 to 3,000 deaths per year. SUDEP causes death much more frequently than SIDS. And we all know the burden of SIDS. We've all heard of SIDS. Well, SUDEP is even more lethal than SIDS. And so I have a little bit of a diagram over here on the right part of this. And this is just simply to show that something that I said earlier, the brain is going to control all the organs in the body. It controls the vital organs, the breathing, respiration, the lungs. It controls how our heart beats, and keeps the blood pumping through the body. And all those things are controlled by the neurons, the brainstem, and the electrical activity that occurs through those mechanisms. And when anything is thrown off there, it can potentially cause a seizure, as we've heard in some of these various stories today. Go to the next slide, please, Allison. And so from my perspective about SUDEP, I'm going to tell you a little bit about the sort of the nuts and bolts of how medical examiner forensics works. So when I'm diagnosing SUDEP, the way that I do that is I have to look for everything else that could have caused death. I can't necessarily look at someone's brain and say that, okay, this person had a seizure. I can see it in this part of the brain, and I can see how the electrical mechanism went awry here. It's just something I can't visually see. And so when I diagnose a death as a SUDEP death, I have to just look for everything else. I have to look at the circumstances of death, and that requires a robust death investigation. And so when a medical examiner or coroner is involved in a death, there's a death investigation that occurs that involves looking at the circumstances surrounding how that person passed away. And it's certainly helpful if we have a history of seizure disorder or epilepsy, and it's helpful if we have a witness seizure, obviously. All those things are important, and then combining that with an actual postmortem examination and autopsy, and then some of the ancillary studies that we do is really the best way to actually understand the true burden of SUDEP by filling out death certificates properly. And all that basically means is a good understanding of the SUDEP burden requires good data, because these diagnoses are often made by medical examiners and forensic pathologists. And Libby talked about her story about not receiving a lot of information about SUDEP, and that's something that we're working towards improving is having a better education involving SUDEP from clinicians and also medical examiners and forensic pathologists, how to properly do these death investigations and fill out these death certificates. And it's something that we've been doing over the past several years. Our national plan will certainly help ignite some of those things. This is a little flow chart here that just shows how the thing that I just explained, how that works. A death in a person with epilepsy, death investigation occurs, postmortem exam, do other studies, and then we certify those deaths. And that can take anywhere from about 6 weeks to 8 weeks or so from that death to when that death's finally certified. So a lot of states lack resources to adequately investigate these deaths. And so a national plan certainly can help improve death investigation and data collection and create some opportunities for improvement in those areas. Okay, next slide, please, Allison. And I see a comment in the chat there, PWE. PWE is simply means person with epilepsy. So that's just what they've been calling the past several years. PWE is person with epilepsy. Let's talk a little bit about risk mitigation and saving lives. SUDEP can sometimes be prevented. So how do we do that? Well, we lower our risk of someone dying of SUDEP by controlling seizures the best that we can. That's so important for neurologists and clinicians to understand about SUDEP and how seizure control and communicating those things with patients and their families is so important. Nocturnal supervision essentially means that methods to monitor people while they're sleeping. And so I think Libby talked about the story of Cameron and how he had a seizure during sleep. Well, there's certain devices and things like that where we can monitor people that are sleeping. And those are things that research is being done and things that are being developed, technology that's being worked on and developed to monitor seizures, to monitor the position of people when they're sleeping, and to better detect those things when they're occurring, so that medical treatment can come to those people as quickly as possible. So a national plan would be hugely beneficial in a lot of different areas. Here's 4 areas that we listed here where we could have a greater federal investment. HHS guidance and support for state education programs. We've talked a lot about education and how patients and their families must be educated to understand the risk of SUDEP and why controlling medications and seeking help with devices and things like that can be potentially beneficial to reduce their risk of SUDEP. There's a lot of there's a few federal death registries on death and SUDEP, and that the CDC and NCHS are a part of, and these can be protected and expanded because the researchers basically look to these registries to understand the true burden and then find cases to research. These registries are hugely important for researchers to know where is SUDEP occurring? How is it occurring? Which demographics is it occurring in? How can we improve research? And of course, NIH funding to improve SUDEP research goes back to the seizure detection devices, nocturnal supervision, some of the things I talked about a minute ago. There are various models of common diseases where that show education being done in a successful way, like diabetes. Now, epilepsy risk management education lags behind these things. And there are ways to incentivize or reimburse providers so that they do have that opportunity to spend time educating their patients. So a greater federal investment, national plan for epilepsy would be hugely beneficial for this very important disease that is very common neurological disorder. And I think that might be my last slide, Allison. Thank you so much for your attention. And I'm sorry I couldn't get my video working here.
Well, Dr. Atherton, thank you so much for that overview. And I'm really sorry we can't see you either, but maybe we'll be able to see you when at the end for questions. So as I mentioned in the chat, if anyone does have questions, please put them in the Q&A feature or the chat. Okay, so now I am going to turn it over to Tom Stanton so we can learn more about the work being done to support families and communities in the SUDEP space and what innovations are advancing that can help save lives. So Tom, I'm going to hand it over to you. Thank you for joining us.
Thanks, Gardiner. I appreciate the opportunity to join and share our family's story. Just to tell you a little bit about my nephew, Danny. Danny Stanton was born in 2005, and he grew up on Chicago's Northwest Side. He was the third of 4 kids with an older sister, Mary Grace, an older brother, John, and a younger brother, Tommy. They were all best pals and attached at the hip, running around their neighborhood and exploring everything like kids do. Danny had his first seizure when he was 2 years old. He only had 3 more that his parents witnessed over the next few years, all of them while he was sleeping. His mom and dad did constant bed checks and often kept Danny in their own bed as a means of monitoring and to be sure that they did not miss a seizure. Fast forward to 2009, after a routine visit to the neurologist, they left there feeling hopeful. Danny was doing well, and maybe he would even outgrow his seizures. It was just 4 days later that my nephew died on December 12th, 2009. He was just 2 months shy of his 5th birthday. The last lines of his obituary, written by his dad, read, "Please go and enjoy your life." Danny did. What followed were the hardest questions any parents can ask. Why him? Why didn't we know this could happen? Why is so little known about a condition that ends the lives of so many? A few months later, Danny's parents shared, "We will not stop questioning until we know the answer, and we will engage all in our effort to prevent another death caused by a seizure." And so the Danny Did Foundation was born. Over time, our family and foundation kept looking for answers until the Danny Did Foundation itself became the answer. The answer for other families like ours and for countless children and adults living with epilepsy. An answer that improves lives through epilepsy education, epilepsy awareness, and epilepsy support. This has become Danny's legacy and his new place in the world. I'll never forget, shortly after we started our nonprofit in 2010, we met with 2 moms who had both lost their sons to SUDEP, Jean Donalty and Gardiner Lapham. It was the first time we had talked with parents who had committed their lives to advocacy and to preventing these tragic deaths from happening to other families. When Gardiner and others founded Partners Against Mortality and Epilepsy, or PAME, we knew it was a critical coalition for us to be a part of. As a member of PAME, we, along with nearly 150 other organizations who are tied to the epilepsies, urged the passing of the National Plan for Epilepsy Act. Since my nephew's passing, we have witnessed the heartbreak of far too many families who have lost loved ones to epilepsy. In nearly every case, those families were unaware that epilepsy could be fatal. Risks, including SUDEP, and the steps that might reduce them were never discussed by their healthcare providers. These families were left in the dark, without the knowledge or tools that could have helped them protect their child. Every day, often multiple times a day, we send messages of remembrance to grieving parents, letting them know their child is remembered and that their life made a difference. We want them to feel supported in their grief and to know that we are fighting in their loved one's honor to make disclosure about the risk of SUDEP a standard part of epilepsy care. My message to members of Congress is straightforward. Anyone living with epilepsy, whether young or old, is at risk for sudden death. The tragic passing of Cameron Boyce brought this issue to the public eye. And just as Cameron is so dearly missed, every life taken means lost memories, missed milestones, and the heartache of a future stolen from being a child, a sibling, a spouse, or a friend. Can you imagine losing a loved one and then learning there were steps you could have taken to reduce the risk, but no one ever told you? That is the reality that my brother and his wife live with every single day. We must do better, and that starts with informed care. We believe that patients and caregivers have a right to this information, a right to know the risks, and a right to take action to protect the people they love. While the exact causes of SUDEP are still being studied, families deserve the chance to take preventative steps now, before tragedy occurs, not after. We may not have all the answers yet, but that should never be a reason to withhold potentially life-saving information. Do the next slide, Allison. At Danny's Foundation, we work to reduce epilepsy-related risks by educating individuals with epilepsy and their families about available devices and technologies that support early intervention during a seizure. These tools can alert a caregiver or loved one in time to take actions that may lead to a safer outcome. Sometimes that means simple, vital steps, like turning someone's face to prevent suffocation, addressing injuries sustained during the seizure, administering rescue medication, or avoiding unnecessary hospital visits. In the most serious circumstances, it can mean taking life-saving measures. The benefits of these interventions are why we at Danny Did have developed a robust awareness program to educate people with epilepsy, healthcare providers, and the general public about seizure detection devices and the role they can play in preventing accidents or worse. These devices not only help save lives, but can also significantly reduce healthcare costs by preventing emergency situations and hospitalizations. Because seizure detection and alerting devices are not covered by either private or public medical insurance, our small nonprofit, the Danny Did Foundation, has become the leading outlet for access to these critical resources. This is not a role we expected to play, but is one we've embraced because families have nowhere else to turn. Each year, we respond to thousands of requests from families who have been denied coverage for seizure detection devices. These families are not seeking luxuries. They are seeking safety. They are seeking tools that may help prevent death. Parents, siblings, and caregivers discover that the technology exists, but access is out of reach unless they can pay out of pocket. For many, that is simply impossible. To fill this gap, we fundraise continuously to provide SUDEP education and devices to families in crisis. The demand grows every year. After 15 years of running this program, we have collected an overwhelming body of feedback. Families consistently tell us that these devices offer something invaluable: peace of mind, increased safety, independence, and hope during one of the most frightening parts of living with epilepsy. In an ironic and surreal twist, we have even received referrals from large insurance companies. These companies direct people with epilepsy to us, fully aware that devices are beneficial, yet unwilling to provide coverage themselves. We often don't know whether to laugh or cry when we receive these calls. No family should be forced to rely on charity or face financial barriers to access a tool that could save their loved one's life. We understand that seizure detection devices are not a cure, but they are a step towards safety and a tool that can empower caregivers and reduce preventable deaths. Families deserve the right to try. We have provided access to seizure alerting devices for more than 4,000 families across all 50 states. And yet, we know we are only reaching the tip of the iceberg for those who are actually in need. Next slide, please. A national plan for epilepsy would provide critical coordination for research into the causes of SUDEP and help to accelerate coverage and access to life-saving resources, such as seizure alerting devices. If such a plan had been in place during the years Danny lived with epilepsy, it's possible he may still be with us today. We'll never know for certain. But what we do know is that increased federal support can make a real difference, both now and in the future. The passage of a national plan would send a powerful message that the long history of pushing epilepsy into the shadows is over. As a country, we are finally ready to confront this devastating chronic condition with the urgency, understanding, and compassion it demands, as we always should have. On behalf of families across the United States, I urge every member of Congress to support this long overdue national plan. We owe it to Danny, to Cameron, to Henry, and to the tens of thousands of families who have lost a loved one to epilepsy. Thank you.
Tom, thank you so much. I am once again sorry for your loss, and I love looking at beautiful Danny on a billboard, which I understand that this is a vision, but one day soon you guys are going to be doing this, and I love that Danny's face is already on buses and in airports. Anyway, thank you. You guys do such important work. So now that we understand the challenges before us, I'd like to introduce Katie Collins to speak a bit more about how we change policies to address the gaps that we've discussed and how we can help families living with epilepsy and heightened premature mortality risks. So Katie, over to you.
Partner. And thank you to everyone who has spoken today. Very, very appreciative of your advocacy. So thank you for being here. My name is Katie Collins. I'm a vice president at G2G Consulting and very honored to accompany PAME on their legislative and advocacy work. We wanted to spend just a few minutes on the National Plan for Epilepsy Act to share a bit about what it would do and why we're so excited about it. I want to thank our congressional leads that you see here, Senator Schmitt and Klobuchar, and Reps Murphy and Costa, who are our bipartisan, bicameral co-leads for the Epilepsy Congressional Caucus, and also for the National Plan for Epilepsy Act, which was reintroduced in February of this year, after its original introduction in November of 2004. And the National Plan for Epilepsy Act would support the development of a comprehensive strategy to address all aspects of epilepsy, from prevention to diagnosis to treatment, to, as Senator Schmitt said, eventually working toward a cure, with the overall goal of improving life for all of those who are living with epilepsy and their families and all of those who live that journey with them. The national plan calls out several priorities to be addressed, and you see them along the right side here, and one of them is SUDEP and other epilepsy mortalities. So this would not only create the first federal plan to address the challenges of epilepsy, but would have a particular focus on SUDEP and other mortality risks and prevention, which we obviously feel very passionately about and know that that needs to be prioritized. I think there were some questions in the chat about the status of the bill. So as I mentioned, the bill was reintroduced in February, and we have been working tirelessly to bring this to the attention of congressional offices nationwide, really working to build up a large co-sponsor list so that we can advance this bill. PAME was just on the Hill last week advocating for the national plan. And this is one place where the entire epilepsy community has really come together to show support for this bill. So very grateful for everyone in the epilepsy community who has helped get this this far. So we'd like to ask you for all of our Hill staffers out there today to please highlight this bill for your boss. We're happy to answer any questions that you and he or she might have about supporting this bill. And let's go to the next slide. I just wanted to talk there, you know, we're very passionate about the national plan, very excited about this, but there are some other things that Congress can do to take action in addition to the national plan. We know that budgets and funding streams have been at the top of the list for everybody working in Congress right now, and we really advocate for robust funding for NIH to support SUDEP research so we can understand some of these underlying mechanisms so we can prevent these deaths. Dr. Atherton noted that more people die from SUDEP than from SIDS, and there's actually some early research that shows that some SIDS and SUDC, or sudden unexpected death in childhood deaths, may be first-time seizures. So we are at the tip of the iceberg here. And in this case, you know, as in many cases, research can save lives. We also talked about education and reimbursement. Again, I think Dr. Atherton mentioned the reimbursement that comes for those who are diagnosed, for example, with type 1 diabetes, and how do you manage your disease and your health. And we need something like that for epilepsy so that every person who is diagnosed, you know, every child and their family have that education to understand what risks they face, how important medication adherence is, and how they can best manage their disease in a way that's healthy and beneficial and hopefully saves lives. And there are, in addition to this reimbursement, there are state health department education and awareness programs to help build awareness, help folks understand about these risks. And we support, any and all federal funding that would advance those efforts. And finally, surveillance. We keep talking about the 1 in 26 who will be diagnosed with epilepsy. We talk about the 3,000 to 4,000 deaths from SUDEP each year. That is likely an undercount because we don't have national surveillance to track this data. So to really understand the burden of epilepsy, of SUDEP, of epilepsy mortality, we need to be able to count those deaths and know what our data is here. So we advocate for strong funding to support these efforts out of CDC and elsewhere so that they're accurately reported. And I'll end with one more plug for the National Plan for Epilepsy Act would encompass these issues. So we really would love your support as we work to make this bill a reality. So thank you so much, Gardiner, for giving me a chance to speak. And I see Britt from Epilepsy Foundation in the chat. If she hasn't put it there already, I will stick a link in there to find your representative. So those, from our stakeholder community, if you want some help getting started, we can get you there. So thanks, Gardiner.
Thank you so much, Katie, for helping us to understand how we can take action to drive change now. It's already too late for the families here on the webinar today, but for other families out there, this is a time to make changes that will save lives. We will now take questions. So if y'all have any questions for any of the panelists, please put them in the Q&A feature, and I will ask you all to come back on. Katie, maybe you can join us, and Libby, you too. Great. Thank you all so much. So I have a few questions, and things are coming into the Q&A and chat, so we'll see how I can juggle this. But maybe I'll start with you, Dr. Atherton. What efforts, you mentioned data collection and challenges around it, but can you be a little more specific and tell us about current efforts to improve data collection, especially SUDEP?
Yeah, so I'll start with just in the
And I'm
past
glad
few
we can
years.
see you, by the
Oh,
way.
I know, I'm so sorry about that.
It's
I
so
don't know what
nice.
happened
So
there,
thank
but
you
yeah,
for
yeah,
logging back
that
on.
happened. Yeah. Okay, well, the questions about data collection, current efforts. So data collection is a hugely important issue, not just to be redundant. We've said that several times. And it comes from so many different sources. So it comes from clinical sources of living patients, obviously, but then a really important sort of part of data collection can come from death certificates. And so some of the barriers to good data collection is not having enough information about these deaths for researchers, because you only have so much information on death certificates. You'd have demographic information, cause of death, maybe contributing factors. Recent efforts to improve that has been trying to get everybody on the same page from a death investigation standpoint and using the same terminology. Because for decades, really, people were just using terminology that they were kind of used to. And so in recent years, we've had efforts within my organization, National Association of Medical Examiners, to get everyone on the same page, have leaders in this space come together and say, this is what we're going to call these deaths. And there's been improvement sort of in that regard. But one of the barriers that does remain to data collection is inefficiencies in just sort of how systems communicate. And that's a huge barrier that needs attention. And a national plan can certainly sort of bring attention to that. And so the CDC does a great job of trying to oversee some of that, but states kind of have their own system. The federal system is a little bit different. And there's just some barriers as far as communication. I guess we've all kind of grown up in this age of technology and electronic communication, but it is relatively young, because only 15 years ago did that really become mandated that offices need to move away from paper, use electronic medical record. And so we're still young as far as all that's concerned. And so, and this is a long answer, but my basic summary of sort of that answer to that question would be improving electronic communication, overcoming barriers with that, having more federal oversight with that, finding better ways for systems to communicate between states and then federally as well.
Thank you. We have a long way to go. Obviously, I'm really pleased with the medical examiner's partnership with the healthcare provider community, with the patient community. I mean, we're not going to make progress on this unless we're all on the same page about what needs to happen. So I appreciate that. There is a question in the chat, which also sort of relates to another question I have. Maybe Tom, you can answer this, or Libby. But it's about, what steps are being taken to ensure that all healthcare providers, especially in underserved communities, are trained to talk to patients and families about the risk of SUDEP. And then another question in the chat was, is there training in medical schools? Are docs trained to talk about this, understand this problem?
Yeah, I'm happy to kick this off. I mean, I know one thing we do spend time on is talking to medical school students through presentations. So we talk to several different schools on an annual basis with the idea that hopefully these, young professionals will make their standard of care different from what it has been historically. And just understanding and viewing epilepsy and the risks that come with it in a different light than maybe a different generation of providers has done. So I think reaching that group and articulating to them, this is what epilepsy is, these are the risks that come with it, and families do want to be informed. We've done surveys across the US and some internationally, asking caretakers and people with epilepsy, how do you want to be informed about SUDEP? And overwhelmingly, they say, from my healthcare provider. And we try to articulate to that community that this engenders trust, it builds a stronger relationship, and that you can do this from a place of empowerment and education. And I fully accept that this is a scary proposition. It can be a hard thing to communicate, but to do it from a place of reducing risk and increasing safety is how we propose that communication takes place.
Yeah, thank you for that. I'm going to ask my colleague to maybe insert in the chat a link to the American Epilepsy Society and the American Neurological Society, the guidelines on SUDEP counseling, because those are not adhered to or widely known about. Libby or Dr. Atherton, do you want to add anything about your experience on this topic?
I would say some medical schools certainly include that in their curriculum, but probably not all of them do. And so that's certainly something that we can make strides in as far as continuing to get that information out there to neurologists and those medical educators that are in charge of those specific blocks to mention what SUDEP is, because it's sort of important to obviously implant sort of that nugget or that seed in that medical student so they remember in residency and then they remember this later on. Those things can certainly be beneficial early on. But I don't think there's any set criteria that mandates them mention SUDEP in medical school, to my knowledge.
Yeah, I can only add that, like, I've heard from many doctors who did not talk about SUDEP with their patients across the states anyway, that they've reached out to us and said they are starting to have those conversations using Cameron as an example, because obviously the kids can probably relate to that, which, you know, is very bittersweet for us, obviously, but we welcome it. You know, I think it's a very big area that needs a lot of attention and a lot of weight behind it to actually make those changes. Just like in the menopause community recently, you know, there's a big push for the medical community to do a better job. We need a similar push on the epilepsy front. And I think we need to, not one organization can do that. I think we all sort of need to work on that together, and something I think that certainly the Cameron Boyce Foundation is very interested in, but we would need a lot of help.
Yeah, great answers. There's a question in the chat. Someone's asking about if there are any pushes in the policy sphere to make detection devices covered by public insurance. And I'm wondering if Tom or Katie might be able to chime in on that. I know there's been movement at the state level in some places.
Yeah, happy to kick that off. I know there's been one state to date that has passed a state level bill that mandates coverage for FDA approved seizure detection devices. And that was in Minnesota, maybe 18 months to 2 years ago. And so that's on the books as a model. You know, one of the challenges is that right now there are only a few FDA approved cleared devices. So I think increasing the pipeline of device companies that get to that point and that are incentivized to go down that road and make those investments is really important, because there are a lot of devices that are just considered consumer level devices that do have applicability and usefulness for families who are looking for a solution. So Minnesota has a law in the books. I think there are other states, including Illinois, who are interested to model that. But I think from an efficiency and urgency perspective, you know, doing something at the federal level would be extremely meaningful, and hopefully this plan would help the coordination to expedite those types of that type of progress. Going state by state is just cumbersome and very meaningful, but it just takes a lot longer.
Yeah, thank you for that. I mean, I do think you're right that there is a strong role for work to be done at the state level, and there's huge momentum now actually across the US. I would encourage anyone interested in state level advocacy or policy work to check out the PAME website. We've got I think it was in the chat, there's a toolkit on some priority state work that could be done around education and devices, but it's the federal level where we really need the support to advance the research and the surveillance that's going to be transformative on this issue. There's more chats or questions are coming in, so I just want to quickly get back to there's a question about risk, Dr. Atherton, and about you know, Libby, I think you mentioned in your talk about Cameron being at a higher risk because he was male. Dan, can you just sort of talk on quickly what we know is the risks of SUDEP at this point, but how, you know, there's still probably a lot more to learn?
Yeah, absolutely. There's certainly a lot more to learn, and that's obviously why I've been talking about the importance of research as far as some of those things. I don't know if people understand necessarily. Maybe they speculate some of the tie-ins to deaths involving SUDEP, like male, for example. I couldn't speak right now about why necessarily that is, but they have sensed some of those patterns. I will say that a couple of things that we mentioned previously about the importance of data collection and death certificates, it helps people kind of identify those risks. And then more research can be done to figure out, well, why is that necessarily or possibly the case? And then that can be communicated to patients from families. But right now, I couldn't tell you specifically what that sort of mechanism is related to that risk.
Yeah. Right. Well, I am going to move to close this up in a minute, but I just wanted to open up to y'all. Do you have parting comments or thoughts or words? Grateful to each of you for sharing your stories.
I would just comment that, we were in Washington, D.C. with Katie last week, and the theme that we kept hearing is, that our elected officials want to hear from their constituents. And I can't overstate how much it means just to reach out with a phone call or a email to let them know that this is a priority, that it impacts your life. And we have to, as a community, really be the squeaky wheel that moves this forward, and do that by sharing our stories.
And Tom, if I can just add to that, I was in a meeting with, one of our groups last week, and a staffer was sharing, about, one of the many important issues that's holding their attention right now. And one of the moms popped in and said, with all respect for everything difficult that Congress is dealing with at this moment, this was a group of parents who had lost their children, and there's nothing more important in their world than their child. And I watched the impact on that staffer, and so you're totally right. They're here, to hear from their constituents and to hear from you and what's important to you. So I can't second that enough, that, if there are folks who want to get involved with advocacy, if you want to reach out to your member of Congress on your own, that's totally fine. If you'd like a little bit of support, we're here to be helpful. So thanks, Tom. Appreciate that.
I'll just add, reading all the comments, and just thank you everybody for participating, for your comments, for agreeing to be a squeaky wheel, for whatever it takes. I'm sure that Gardiner and Allison and Katie, everybody will sort of take these comments and keep your information so that we can continue this work together.
Okay. Well, I want to now just thank all of you for dialing in. If you're a staffer for a member of Congress, please consider co-sponsoring the National Plan for Epilepsy Act by contacting Congressman Murphy or Costa in the House, or Senator Schmitt or Klobuchar in the Senate. And if you're someone living with epilepsy, or a loved one of a person living with epilepsy, please join us and advocate for change. You can contact your member of Congress to ask them to co-sponsor this bill. We're posting the link to look up your U.S. representative in the chat box, so that should be somewhere. And if you're learning of this issue for the first time, we invite you to learn more. Visit either the PAMEonline.org or Danny Did Foundation or the Cameron Boyce Foundation. All those organizations have great information and can help connect you where you need to go. And so just please reach out. So together we can really change this landscape for people living with epilepsy and their families, so that others don't have to experience the pain of losing a loved one to potentially preventable death. There's a lot of work to be done, but there's a lot of momentum, and I hope we can all join together to continue pushing this important bill forward that will be truly transformative for those living with epilepsy. So we'll send a link of this recording to all who've registered, and it'll also be on PAME's YouTube channel. Contact information for our panelists will also be shared in a follow-up email. Again, thank you so much. And just a reminder, we're sorry we weren't able to answer specific medical questions, but please reach out to your medical team for any questions that this webinar may have risen for you. But again, we're so grateful, and we look forward to pushing this to get forward together. So thank you all for joining today.